Hey, it's Chris Beyer.
Chris Bowling.
Brad Johnson here.
How are you, Brad?
Bottom line Thursday. Hey, Brad, what do we
Doing
have
well. Had
today?
my coffee, quasi awake.
Good.
Good. Yeah. Well, hey, surveys are coming out. Well, in terms of
Yes.
what rate increases might be or actually will be in some cases, you want me to give you the highlights on
Yes,
some of
please.
these?
Yes.
Okay. So we're going to look at it from a standpoint of we're going to look at CalPERS, and these are their
Yep.
actual rate increases for next year. You might recall CalPERS covers 1.5 million active and retired employees in
Yep.
California, even though we're not in California, kind of a good barometer. Huge self-funded plan. They were seeing an 8.2% increase. So
Wow.
those are legit increased numbers. Now they've got a ton of plans, some lower than that, some higher, but
Right.
that's the average. But then Price Waterhouse Coopers came out with their carrier trend survey, and they, instead of being actual renewal like CalPERS, they talked to 24 insurers, many Blue Crosses, of which
Okay.
Wellmark and Healthcare Service Corp were in there. Their trend number was 8.5%, exact same as
Wow.
last year.
Oh,
And then finally, a different angle to measure what folks are thinking. International Foundation surveyed 150 of its members, and these are what the employers that are participants felt the increase would
Right.
be. And they're booking on average a 10% increase. So it doesn't matter if you
Wow.
talk to, and surprisingly, the insurer one, the Price Waterhouse Coopers at 8.5 was lower than what the employers are bracing for. Usually carriers have a little fudge factor
yeah.
because they
Yeah,
don't
you
want to
would
adjust
think.
low. And
Yeah.
then CalPERS at 8.2. So we got 8.2 CalPERS, 8.5 Price Waterhouse, and 10% International Foundation. Take your pick.
So,
What I would say with all three of those is even the self-funded plan in California, I guarantee they're just running the plan as they run the plan. There's no pharmacy creativity. There's no direct contracting. It's just we're just letting the network be what it is, and all of our providers are renegotiating.
Yeah, I think that's a fair statement.
so Brad,
Well,
that 8.5 on self-funded, that's obviously a budget increase, not just a stop loss increase, right? This is your budget.
correct.
Okay.
That's all in. Kind of
Wow.
a premium
Wow.
equivalent figure
That's
that they're using.
that's horrible.
Last year was like 10.2 for them on
Wow.
1.5 million people. You think of the law of large numbers, you shouldn't have much
It's not
fluctuation.
helping.
No, that's scary.
Yeah.
That's not
So,
good. I mean, it's
yeah.
all, again, hate to keep pounding on GLP-1s, but you know what? Buyer and I ran into a couple rural hospitals that are covering weight loss, and it was, yeah, that's why your
Exploding their
budget's being
budget.
crushed.
Yeah.
Yeah.
That was mentioned in all of these as a
Hmm.
contributor. Now, one thing that was interesting, and I have to think which survey it was, maybe the Price Waterhouse Coopers one. Um, Inpatient mental health
Yes.
was up like 80%.
We,
Outpatient
Yeah.
mental health up a lot. And so we know that there's big pressures on mental health, a lot more issues going on out there, but I didn't realize it was that high of a percentage.
we have a
You've
client
seen one client. Yeah, you were going to say it.
since
It's two
2023.
inpatients. Yeah.
23 went from 150 to 350,000 in mental health claims. 24 went to 400,000, and we're already at 250 as of June. So now we're starting to look at point solutions for mental health because the access is so bad. People
Right.
can't get to see that outpatient provider to get some help. So now they're going
Yep.
straight inpatient. We
Yeah.
had someone out in California, Brad, that was 5 grand a week. I'm sorry, 5 grand a day. I'm sorry,
A
Yeah.
day.
a
Yeah.
day.
Residential.
We were
Yep.
running 150
Yep.
grand every month that guy was in there. And I mean, I get it. People need help, but dang, 150K a
That's
month
expensive.
is insane.
Yeah.
Yeah. Yeah.
So yeah, it is a problem. Um, that stinks, man. 8.5 is not that's not manageable. It's just
No.
not.
No.
No. It's up for certain. I think I used to use a rule of thumb of 6 to 8. Now I feel like I should increase that to 8 to 10.
Yeah.
Now, I will say a different survey that I'm not citing here. I had read that the Midwest is trending slightly lower,
Okay.
maybe by about a point. So,
Okay.
and a group
Yeah.
needs to
8 to 10
discount
sounds good
their
to
own
me. I
trend.
mean,
And
not great, but that's a number that makes sense, I guess I should say. It
yeah,
doesn't sound good to me. That was a
Does it?
horrible phrase.
yeah,
No,
lucky
no.
number 7, maybe. we'll go with.
Wow, Brad, as usual, thank you for sharing. It's just incredibly insightful. So thank you.
You
Thank
bet.
you.
So next week, let's talk about the individual market. And
Absolutely.
these numbers look low compared to that.
Oh
So
no.
stay tuned.
All right.
Stay
Thanks.
tuned.
We'll see you next
Stay
week.
tuned.
Thanks, guys.
See ya.